Hello, it is just a test live. Am I audible? Am I really audible? Let me check it out on YouTube. So, yes, I'm gonna discuss about how the uterus and how it functions. Am I audible? Yes, right? So, this is just a test live, just to make sure that to start. So, yeah, if you do have any queries, you can ask here about the uterus. Okay, so this is what you call as, this is called as cervix. Okay, so and this the whole part of uterus, and this one is called as the normal ovary. Okay, and where you can see the polycystic ovaries. Okay, and endo, polyps, fibroids, you can see everything in this model. Okay, so let me tell you how it functions and all. Before that, do you want me to discuss any particular topic, like about the uterus or endometriosis or something like that? Just let me know. I just want it to be interactive, that's it. Okay, so I can explain everything in detail. So what's going on with my uterus, what is happening? Okay, so too many times I've seen women, like ask me, like what is wrong with me, what is going on with my uterus. Okay, so what happened, and it was normal before and after marriage, or after pregnancy, first pregnancy, it was very abnormal and all, right? How many of you feel that asking the same query, like what is going on really, why me always, uh, is there any treatment options? Okay, see, the 28th day and 26th, stomach pain and light white discharge with blood. Okay, so that is completely normal. See, let me tell you one thing. Pregnancy symptom and premenstrual symptoms both are completely same. You cannot predict pregnancy with premenstrual symptoms or pregnancy symptoms. Either you need to check the UPT after 5 to 7 days of your missed period, or else you can check early pregnancy blood test, which is beta hcg. You can check it out after 5 days of missed period. Okay, then you can easily identify, but based on the symptoms we cannot exactly predict. Okay, hope it is clear now, right? So let me discuss about the abnormal bleeding. Okay, so where it, especially we often ignore the abnormal menstrual bleeding, like heavy periods or bleeding between periods. Okay, so if left untreated, like most serious problem can arise. For example, like for fibroids, polyps. Okay, uh, like large fibroids. If fibroids growths are there, it can press other organs in the abdomen and pelvis, which also includes the bowel, bladder, and the blood vessels. Okay, so that uh, kindly avoid ignoring abnormal bleeding. Okay, so that is very important. Sometimes endometrial ablation, okay, that happens inside the lining of the uterus. Okay, so that also cause the heavy bleeding associated with fibroids. Okay, so if you ask me, can pregnancy possible with this abnormal bleeding? Of course yes, but it should not be left untreated. That is very important. Okay, so as I mentioned before, it is just a test live. I just wanted it to be interactive. Hope I am audible, and is everything audible? Am I clear? Is the video clear? And when I was discussing the abnormal bleeding, so let me explain one more thing. Abnormal bleeding is also the most common symptom for polyp. Sometimes if bleeding happens between period, sometimes bleeding after intercourse or overly heavy periods. Okay, and the fibroids and polyps can be easily identified through transvaginal ultrasound, which is TVS scan. Okay, and yes, last month I got done with, right. And see, pregnancy, is it possible? If you ask me, after the procedure, the 6 months are the golden period. Okay, so you can plan, you can take treatment, that is completely fine, but we cannot exactly predict whether it is possible or not, because results completely based on how your body responds to the medicine. Okay, make sure that you are following healthy lifestyle, that is very important, and medicine only support 40%, your body should support 60%. Okay, hope it is clear now, right? So yeah, the fibroids and polyps, right? So what exactly the polyps? Polyps, it's like an overgrowth of the cells that lines the uterus and extend to the uterine cavity. Okay, the small dots. Okay, and here anywhere it can be found. Okay, inside the uterus, anywhere it can be found. It is small outgrowth of the cell. It's like a tissue. Okay, and it can be sometimes it may be benign, sometimes cancer can be found them into. Okay, so it affects premenopausal or postmenopausal women, so we cannot exactly predict who it is affecting. Okay, so once we identify the polyps through transvaginal ultrasound, okay, so we can immediately start taking care of our lifestyle. That is very important. Okay, and ma'am, is it recommended to remove polyps? Of course, yes. If the size is too big, yes, of course, it is recommended to remove it. But if it is too small, you don't have to. Okay. Yeah, and yeah, let me discuss one more thing about the abnormal bleeding. Okay, so adenomyosis, adenomyosis is, it's a condition, not like the fibroids and polyps. It's like an outgrowth of the cell, a small tissue growth inside or outside of the uterus. But adenomyosis is a condition. Okay, normally it lines the uterus growing into the muscular wall. It is the it is in, it is like an enlargement of the uterus. Adenomyosis is a condition where you can find the enlargement of the uterus. Okay, and especially you can see after pregnancy. Sometimes right now 20 to 25% of women can see the adenomyosis before pregnancy itself. Okay, that's why you need to check when you have more bleeding or more pain during pregnancy, like periods or sex. Okay, sometimes pelvic pressure, okay, too much pelvic pressure also causing this. Okay, like if you ask me what are the treatment conditions for adenomyosis, okay, uh, we never suggest any treatment options, but still there are few options you need to discuss with the doctor. Okay, and if you are planning for pregnancy severely, I strongly recommend lifestyle changes and diet. Okay, it can control the symptoms, but if it is like too big and if you are more than 40-45 plus, you know you need to choose surgical option. Okay, that is recommended if medication doesn't work. Okay. Yes, hope it is clear right now about the abnormal bleeding, polyps, fibroids, adenomyosis. Okay, so the main symptom of all these are like abnormal bleeding, heavy menstrual cycle, heavy pain during periods. Okay, pain between period. So these are all the things you need to take care of it. Okay, right? So what causing the abnormal bleeding? Heavy menstrual bleeding, like uh, that may be because of hormones, that may be because of birth control pills or polyps, or sometimes iron deficiency also causing the heavy bleeding. Okay, and even if you have low red blood cell counts, okay, that also causes heavy bleeding. Okay, yeah. Can conceive with 20% motility. See, motility, it is like you can easily increase motility with lifestyle changes, but yes, it is possible. See, out of millions and millions of sperms, we just need only one healthy sperm. So natural conception is possible with simple lifestyle changes. You don't have to go for IUI. Okay, so yes, it is possible, Ramya. So as I mentioned before, it is just a test live just to make sure that whether it is working, or it is completely new to me. So I'm just explaining about abnormal bleeding, what is happening inside the uterus. Okay. So if you do have any queries, you can ask me. Let's do Q&A weekly once, okay? So that we can discuss how the uterus works, what is fallopian tubes, and all. Okay. Is chocolate cyst in ovary cause pregnancy? I have. Yes, chocolate cyst. Okay, depends on the size. It may affect pregnancy. Okay. So, don't worry. So, if you are not married, you don't have to worry about it. Just start lifestyle changes and plan pregnancy. And if the chocolate size is too big, start doing exercises. Okay, you can start Kegel exercises. Okay, pelvic floor exercises. It helps a lot. See, for all the uterus problem, Surya Namaskar is the best issue, best solution. Okay, so you can do Surya Namaskar anytime. Okay, it is best for reproductive health. Yeah. So let me tell you what are the common causes of heavy menstrual bleeding. Okay, it may be, yes, hormonal imbalances. Okay, as I mentioned before, adenomyosis, polyps, fibroids. Okay, and sometimes pelvic inflammatory diseases also. Okay, endometriosis. Okay, red blood cell, if you do have very low red blood cell, or if you do have very low hemoglobin. Okay, yes. So this is what you call as the whole uterus model, and this one is your cervix, this one is your uterus, and these two wings are like fallopian tubes. And let me tell you this one. This one is the fallopian tube, and this one is normal ovary, and the one which you can see here is the ovary with polycystic ovarian syndrome. Okay. See, if both sides blocked, okay, uh, natural pregnancy is possible only after laparoscopy, dear. Okay. So after laparoscopy, still the tubes are blocked. Yes, you need to choose IVF. Okay, after laparoscopy, if at least one tube is fine, you can, yes, natural conception is possible. And yes, her husband count and motility can be improved with diet and lifestyle changes. Okay, so yes, hope it is clear now, right? So this one is the 5 miscarriages due to Afrin. What is the root cause? Do you have any medical history that I should aware of? Just let me know. Okay. So let me discuss the polycystic ovary. What exactly is polycystic ovary and why it is affecting the pregnancy? You can see the normal ovary is like this. Okay, and the polycystic ovary is like this. Okay, that's why. Okay, you can see that, right? As I mentioned before, Afrin, I just need to know your medical history. Okay. Yes, of course. Yes, personal consultation, teleconsultation available. You can mail us. Okay, or else you can ping us at Insta. I'll ask my team to be in touch with you. Okay. Yeah. Tomorrow I can connect with you. Okay, Padma. Tomorrow just uh, DM us. Okay. I'll ask my team to help you. Okay. Yeah. Any other questions? Shall we move on to endometriosis or polycystic ovarian syndrome? Anything else? Okay. So yes, let me start with this one, polycystic ovarian syndrome. Okay, this is the polycystic ovary. Okay, and it is also a common one right now. Okay, so like with PCOS, regular period or irregular period might be possible, or you may have period that may last many days. Okay, and sometimes the testosterone will be high. Okay, and sometimes small sacs of fluid, okay, develops inside or outside the edge of the ovary. Okay, that is called the follicles, and sometimes the follicle fail to regularly release eggs. Okay, and sometimes androgen will be high or very low. Okay, so these are the like common known, okay, things about PCOS. Okay, my medical history good ma'am, but before I'm getting into 8 week spotting starts. So just do check karyotyping, okay, or else genetical testing. You can check with your doctor, okay. And without medical history, it is completely not possible to identify what is causing this, okay. So do check it once, okay, the karyotyping or genetic testing. You can check it out, okay. I'm recently married and trying to conceive for past 4 months. Which session I can refer you? I have PCOS issue. So you are just married for 4 months and periods are irregular. How many days are your period? Did you check a karyotyping, dear? If it is normal, okay, so start lifestyle changes for your body, for your baby, okay. So if everything is normal, you don't have to worry about it, okay. So all you need to do is you need to start taking care of your health, okay. Your body should support you, okay. To support your baby, your body should be healthy, okay. So you don't have to worry about it. Just take care of your health and take care of your husband's health also, because a husband sperm also plays an important role in baby's health, okay. So yeah. So without period, if it is fine actually. So you don't have to take the tablet, okay. You don't have to take the tablet every time, okay. So for period irregularities, you are just married for 4 months, right? So start taking care of your diet. That is very fine. You don't have to take any tablets right now, okay. Having regular periods can sure ovulation done every month. uh, like no, actually, so we cannot, as I'm we cannot exactly predict what is happening inside our body. So you need to check follicular study whether the ovulation happened or not. How to balance hormones? See, always I suggest lifestyle changes, diet and exercises only. So I never suggest any other medicines or else. So start doing lifestyle changes, okay. So yeah, so let me tell you what are the symptoms of PCO, like PCO, how it is affecting, and what is happening after with the period, menstrual cycle, and all. Okay. So how can we diagnose PCO? That is very important, right? How exactly can we diagnose? Of course, if you do have irregular period, how can we, what is irregular period, ma'am? So if the cycle is happening between uh, uh, like you know 28 to 35 days, if it is short cycle 21 to 28 days, and if it is long cycle up to 35 or 42 is completely fine, okay. So and after that, if the periods may occur more than 35 days apart, and if you do have trouble getting pregnant, yes, you need to diagnose immediately, okay. So having And which program referring to me in case from your offerings? So I need to check your medical reports. First of all, your abdominal scan and your hormones. Okay, so if it is like mild PCO and if your periods are very regular and if you don't have any other issues, you can start fertility diet. If you do have particular issue and if it is severe, you need to concentrate on your hormones. Okay. Yes, of course. 5 miscarriages, it is not okay. I won't say that it is okay, but still you need to take care of yourself. Having one ovary can conceive. Of course, yes, you can. Okay. So yes, hormonal imbalances, lifestyle changes. You need to take care of your diet, okay, based on which hormone is affecting your body, and what are the symptoms, is it affecting pregnancy or post pregnancy, or based on that you need to start your diet and lifestyle changes. Okay. So polycystic ovary. Okay. Polycystic ovary, sometimes your ovaries might be bigger. Many follicles, okay, sometimes the follicle does have immature eggs, right? That immature eggs, okay, that start to develop around the edge of the ovary. That is what causing the polycystic ovary. So once many immature eggs, okay, developed, okay, sometimes the ovaries might not work the way they should. Okay, that is why it is affecting the pregnancy. Okay. So when what are the uh, like you know exact causes of PCOS? Sometimes it is completely unknown. Yes, of course, after hormonal imbalances it might happen. First thing, I just wanted to take care of your insulin. Okay, because when you start when you have PCOS, whenever you visit the doctor, of course they'll be suggesting metformin, right? Metformin, if you can ask me, simply it is for it is to control your sugar level. Okay. So metformin it is not for PCOS or PCOD. It is to control your blood sugar level. So you need to take care of your insulin first. So insulin resistance. So what is insulin resistant? Sometimes with PCOS the blood sugar levels can go up. This can cause your body to make more insulin to try to bring down the blood sugar level. And too much insulin might also cause your body to make too much of the male hormone androgen. As I mentioned before, if you do have heavy androgen, sometimes the hairs on your chin and hairs on your cheek, okay, the extra hairs around the body, the pigmentation around the neck, okay, the patches around the neck, armpits, under the breasts, okay, and these are the one of the main symptoms of insulin resistance. Okay, your skin might see the darkness. Okay, it might be dark. Okay, you can see the patches, especially around the chin area, cheeks area. Okay, so insulin resistance you need to take care, especially when you diagnose with PCOS. You need to monitor your sugar level. Okay, can I give birth to a child after 5 miscarriages? Of course, yes, you can. Okay. Let me drink some water. Yeah. Any other questions? Shall I discuss the complications of PCOS? Let me do Q&A weekly once, okay, so that we can discuss. So it is just a test live. I just wanted to make sure that whether it is working or not, I can communicate or not. Okay. Any other questions? Shall we move on to the next topic? So, what are the complications of PCOS or PCOD, polycystic ovarian syndrome? The first thing is infertility. Okay, so pregnancy might be difficult, and if you do have if you do have PCOS and if you are pregnant, sometimes it affects your pregnancy, the gestational diabetes. Okay, sometimes the blood pressure and blood sugar might be high. Okay, and PCOS also affects your baby, like early pregnancy. It may cause uh, the miscarriages. Okay, miscarriages might happen. And yes, diabetes, as I mentioned before, type 2 diabetes or insulin resistance, you need to take metformin. Okay, or else you need to control the blood sugar level, or you need to monitor your blood sugar level. Eating disorders, so your appetite will be very big. So yes, eating disorders might come, depression, anxiety, the patches around the neck, and hair, excessive hair fall, the darkness around the neck. Okay, so yeah, so what happens if our body produces more androgen? What exactly happens? So having too much androgen interferes with ovulation. Okay, sometimes the follicles which won't be released, or which don't develop on a regular basis, or like sometimes the immature follicles forms a cyst. Okay, so that's why excess androgen affects pregnancy and ovulation. Okay, okay, fine. So yeah, okay, we'll discuss another topic, and just update me. Exercise, increase food. Okay, so immediately if you ask me, one such food or one such exercises won't help for the exercise or anything. Okay, so you need to concentrate your whole lifestyle changes, and the exercises are mandatory. As I mentioned before, Surya Namaskar is better for reproductive health. Start Surya Namaskar and start doing exercises and start diet immediately. Okay, and if you do have any hormonal imbalances, please do take care of that. Then only you can increase your exercise, right? Okay, fine. So I will discuss some other topics next week, and we'll do Q&A every week. Okay, and yeah, baby does to everybody all the very best. So whatever it is, okay, start your lifestyle changes immediately. That is very important. Okay, so as today is not just another day, so whenever you start something, okay, just don't think like tomorrow we can do it. Okay, so we'll find ourselves caught in the loop of tomorrow, right? So tomorrow I'll start exercising, tomorrow I'll start eating healthier, tomorrow I'll do this. Let me tell you one secret: tomorrow is not guaranteed. Okay, the longer we postpone, the more precious time slips through our finger. Okay, so remember like the journey to the pregnancy is like not a sprint, it is like a marathon of consistent and intentional choices. Okay, so start right now. Okay, take a deep breath, step boldly into the day. Okay, start today. Okay, so that is very important. Okay, you only have the power to shape your destiny, not everybody, not your doctor, not me, not your friend or anybody. Okay, so you have the power to shape your destiny, make it yours. Just today is not just another day, it is like an extraordinary journey. Pregnancy, like it's an extraordinary journey. So like don't let fear or doubt hold you captive. Okay, so rewrite your story. Okay, make it happen. Whether your goal is to improve your health or like chase your dreams, pregnancy, whatever it is, don't don't find yourself caught in the loop of tomorrow. That is very important. Okay, today is the day. Start your lifestyle changes and diet immediately. Okay, can we take folic acid tablet? Of course, yes, you can take it. Okay, so yes, don't waste another moment waiting for the perfect time to make the changes. Start right now. Okay, yeah, we can discuss some other topic tomorrow. Okay, yeah, take care. Bye bye. Good night.